Michael Moore's documentary Sicko, if you haven't seen it, I encourage you to do so, highlights that the American system could be better. I don't agree with all views on that, but I do agree in principle that we need to redo the system. We need to revamp it. You know, him going to Cuba and all these other things, I don't agree that trying to extol the virtues of Cuba is the way to make America feel touchy-feely or open to redoing its healthcare system. But it brought out a stark contrast that you know, we are 30-something in the ranks among industrialized nations on how we deal with our health care. With that being said, you know, we need to look at other ways to handle health care, and also perhaps take them to court. Take these HMOs or take these third-party administrators to court. Much of the liability that's going on, unfortunately, they're insulated from that liability. We've talked about previous shows where you could sue your insurance company, and you could hold them for bad faith. They weren't dealing with you in a proper way, or they denied your claim when it was reasonably clear there was coverage. But when you have an independent administrator, you encounter many other difficulties. There are immunities that they have, so to speak, where you can't, you don't have quote-unquote standing. You're not the person to stand in the shoes and bring the lawsuit. And that's why, and the dirty little secret that they have is that they are perhaps not negotiating the best prices for the employee, the hardworking people out there. You know, anybody can be affected by this depending on your plan nationwide. Teachers, firemen, even healthcare providers. We don't know exactly because there's never been any accounting. Now with this blockbuster article by Forbes magazine that's coming out on the 13th of August 2007 that we're looking at, and it's entitled Slicko, S-L-I-C-K-O, which is a play on words with Michael Watts' documentary Sicko, indicates that I think Michael Moore, in his sensational documentary, has it all wrong. They're not being too chintzy in paying claims. They're paying out too much. They're being too generous because it's not their money. It's the blue chip company's money. And I'm sure they're gnashing their teeth now that it's all coming out. It wasn't their money. They come in there and they act like a middleman. And this is what we've been trying to say all along. They pay way too much, or they mismanage, and that's what really raises healthcare rates. It's not lawyers suing. Time and time again, the American Association for Justice, formerly the Association of Trial Lawyers of America, the New England Journal of Medicine itself indicated that lawsuits don't raise malpractice rates that much, or the cost of delivering health care. What it does is the healthcare fraud in this nation, which is nearing 10 to 20% of all the healthcare dollars out there. There's a lot of healthcare fraud out there, unscrupulous healthcare providers, middlemen handling the insurance money. A lot of people are trying to make a buck because people don't want to believe that healthcare providers or healthcare administrators are crooks. But I tell you what, ladies and gentlemen, it's coming. And we here want to spearhead that effort. As a healthcare provider and a lawyer, I want to try to educate the public just to be aware. I'm not saying every hospital or every plan is corrupt, but they certainly can mismanage, whether they intend to or not, your hospital bills and how much your premiums are. I'm hearing from Jeffrey Barber and others like him, Matthew Dubnasky, an accountant in Baltimore that I talked to also, indicated that we have got a lot of mismanagement up to the tune of $1 billion. And that's annually, $1 billion. I mean, that's a lot of money. And that affects all of us. When I asked, is it just Texas? Is it Southwest? He said it's everywhere. Every state is encountering this. People see that there are errors, whether they're intentional or not, and we need to look at it. And that's why we brought this case up. In the second part of our segment, we're going to be talking about the mechanics of bringing one of these lawsuits. And part of that is going to be, are the teachers going to rise up and say this is wrong, or a group of people collectively going to do it, or are the shareholders who invest in a company going to say, wait a minute, you got to tell me, you're telling me that I invested in this company and this company went with this healthcare administration people, and these healthcare administration people screwed it up and they lost millions of dollars that the shareholders should have been entitled to. That's the second part of it. Can these shareholders bring a lawsuit? I think they can. I think that they can hold not only the CEO responsible, but they can hold that insurance managing company, that third-party administrator, that they had an administrative service agreement to manage the health care. I think they become a target too, to be sued in federal court or in state court. Most of this is going to be under an ERISA plan, and we'll talk more about that on the second segment. But with that being said, the one thing that I want you all to remember throughout this program, we've been talking about the Forbes article, and the Forbes article wants to educate you and let you know that there are more healthcare fraud angles than you could throw a stick at right now. Healthcare fraud, people that are unscrupulous or that get greedy or just don't think, or that are careless or mismanaging your money, and you need to know about it. Educate yourself. Every time you have a loved one in the emergency room or in the ICU or in a regular floor, ask questions. Many of these people, especially the elderly, don't have the ability or the skills anymore. You get old, it's hard, you're on medication, you don't feel well, you don't have the strength to advocate for yourself. And as I always say to everybody, and I've had people call me out on it, I don't care, I'm going to say it. I dealt and lost my dad and had to deal with that, and I used to be one of the primary caretakers for him. You make noise. You get more and better treatment through your healthcare providers if you're a PIA, and we know what a PIA is. And you go out there and you tell them what's going on with my dad or mom. Why are you doing this? Why are they discharged like this? Should they be discharged? What kind of medicines are they on? Am I going to get any discharge planning instructions? Am I going to get any teaching at home? They don't do that anymore. Why? Because they're trying to cut corners. They're trying to save money on health care, and that's wrong. You know, we are advocating, and I am advocating, and I'm going to be talking to leaders pretty soon, and we're going to be talking about this more and more, about creating standards where a nurse gets 4 or 5 patients on a ward apiece, not the 12 or 15 that's going on nowadays. And I'm angry about that, and you should be angry too, because every time you're in the hospital or someone else, think about that. There's always low staffing because the hospital wants to put profits over people. Show me a hospital that isn't forced into providing more nurses for more patients. Ladies and gentlemen, I'm going to close this part of the segment that we're looking at, and we'll continue with the second part on this. But I want you all to remember this. You're a consumer. You're a patient. You have rights. You need to have information given to you by your doctors, nurses, and other healthcare providers. And when you look at that bill, you better look at it like it's somebody who built your house, or you better look at it like a contract when you buy a car or a condo or something. Take it that seriously. Don't just assume that the hospital has it right, because remember, we are bringing out the fact that over 80% of hospital bills are wrong. We'll be back with a second segment, but first of all, and primarily, I'd like to thank our sponsors. www.thematthewslawfirm.com. Good friend of mine, David Matthews and Jason Webster, and other excellent attorneys in Houston. Serious personal injuries at thematthewslawfirm.com. They can help in your time of need and investigate very serious cases. That's thematthewslawfirm.com. And one of my favorites, Tommy Holbein from ImpactCreditGroupUSA.com. He can help with any of your credit problems, and we're going to be talking about that, how in another segment, how the credit bureaus are messing with all of us and not reporting what they need to report, and our credit determines who we are. Juan and I have talked about it before, and we'll talk about it again because it's that important. But remember our sponsors once again, thematthewslawfirm.com and Impact Credit Group USA. This is Joe Flores, and thanking you, and we'll be back with our second segment when we come back.